All right. Hi, everyone. Thanks for joining us tonight. We're really excited to share with you some new technologies that we've added to the Michigan Center for Regenerative Medicine treatment options for our patients.
Yep. So here at MCFRM, we're always striving to give our patients the best and most forward-thinking treatments that we can to improve our outcomes.
So we were recently at the primary society that we're involved with, the Interventional Orthobiologics Foundation. Dr. Santana is supporting their logo here tonight. And while at that conference, we were presented with really impressive data supporting these technologies and how they're augmentative and helping our other clinics and other patients around the country experience better outcomes from their regenerative procedures. And so we decided we needed to add this to what we can offer for our patients as well.
Yeah, so the first thing that we'll talk about is something called extracorporeal shockwave therapy, or just shockwave for short. And the other one is something called EMTT,
or extracorporeal magnetic transmission therapy, EMTT for short.
Yeah.
Both of them work in a very similar fashion as far as helping to augment therapies, but we want to talk in more details exactly each one and how it works and why it's helpful.
Right. So as you know, the field of regenerative medicine is still fairly new. So there's a lot of new discoveries on how we're learning how to treat musculoskeletal conditions and musculoskeletal injuries and how to help your tissues heal better and faster. So the whole premise behind EMTT and Shockwave is very similar to what we see with regenerative medicine, is to enable your body to heal itself by using your own tissue. So with the technology with Shockwave has been something that's been brewing over the past few years. Our colleagues in Europe Europe and Asia have a head up in kind of using this technology more than we have. And over the past few years, it's been gaining a lot of traction and momentum as more studies come out and more proof of evidence of its efficacy is coming out. And finally, we decided to look into it deeper, and that's what we decided to incorporate here in our practice.
It's something we've been eyeing for a long time. Part of it is there's some refinements within the technology, Shockwave in particular, the two big categories being radial or focused, and waiting for some of the technologies to get refined. We decided to pull the trigger on the focused technology. So I'm going to explain a little bit about the difference between the two and why we decided on the focused Shockwave.
So Shockwave has been around for a while, right? So the most earliest, I guess, medical use for Shockwave is for kidney stones. So like something called lithotripsy, if you have a kidney stone or something like that. It's an interesting story that when they're doing a kidney stone treatment for a patient, they noticed that the iliac crest, the bone like kind of just overlying the pelvis, is growing more tissue. It's actually getting thicker and also looks more healthier and more density. And so they kind of started thinking like, oh, maybe there is some regenerative properties that the Shockwave has, not just destroying these calcifications in your kidney. So from there, they started looking at more of the research and dedicating more on the regenerative properties of Shockwave, and were able to show that the Shockwave energy kind of works very similar to how regenerative medicine works. So in a way, you're delivering these really focused energy pulses into specific injured tissues. And what it's doing, it's starting this inflammatory cascade and this whole healing process. Kind of like the same thing that we do with regenerative medicine, is that we're inducing a inflammatory cascade and healing cascade in order to heal that tissue. But instead of using PRP or prolotherapy or an injectable, you're actually using these focused waves through the skin, which is one of its main advantages, is you don't have to poke anything, and then delivering the same signal into the joint.
So we'll demonstrate how it works in a few minutes here, and you can see how easy it really is to apply. And the patients do feel it. You can feel where that when that energy is dialed into the right level, over the right location. You can feel that shock being absorbed by the tissues. The way I describe it to my patients is we're trying to mimic basically the body's response to an injury. So when you're roll your ankle, for example, and you sprain your ankle, your body releases growth factors to that energy that caused the trauma. So this is a very controlled amount of energy, a controlled trauma, if we want to think about that. We're not damaging any tissues by doing this. I don't mean that by saying it's a trauma, but it's simulating your body's response to a trauma by giving that focused amount of energy.
Yeah. So one of the other things that they've seen before is that in joint tissue, you have these mesenchymal stem cells in the joint tissue that with arthritis and degeneration, they become senescent. So they stop being active and stop being regenerative. So with the focal shockwave, you're actually waking up these senescent MSCs, these mesenchymal signal cells, to activate to start healing the tissue. So it's just pretty neat because that's how PRP works, that's how stem cell works, that's how all these other genetic treatments work, and so it kind of goes along the lines of kind of what we do. And then the difference between radial shockwave and focal shockwave is that focal shockwave is a lot more specific. As the name says, it's very, very focused to specific areas and specific tissues. Radial is usually something they use for myofascial issues or muscular issues. Here at MCFRM, we treat primarily with joints, tendons, ligaments, things like that, more in a direct type of injury, tendon tears, ligament tears, arthritis. So the focal shockwave has more utility for our purposes. But radial shockwave has its function as well. But for our purposes right now, our focus is to just treat those specific units.
Yeah, and we have adapters on the focal shockwave as well that help us to bring that energy level very superficial. So if we are treating things that a radial shockwave is good for, our focus shockwave still treats that as well. There's a couple different ways, energies that are mechanisms of creating that energy as well that goes into technology. Some use magnetic, others use basically like a drum to create it. Others use the ultrasound piezoelectric effect, and ours uses essentially the drum to create this sound acoustic wave of energy that is very focused to specific tissues and specific depths.
Yeah. So I guess the next question is who benefits from shockwave and these types of treatments. So essentially, it's everyone. So
it's everyone we're seeing. Yeah. It's all of our types of patients that are good candidates for regenerative medicine are also good candidates for this type of therapy as well.
So I would say a lot of times I want to say we're probably one of the few clinics in the country who's actually incorporating shockwave treatments along with our orthobiologics. Most places, they just focus on the orthobiologics part of regenerative medicine, which we were for a long time. Some places would focus on the shockwave part of regenerative medicine, but we're actually looking at incorporating the two because even though they work very similar, it makes sense as they work, the delivery is different enough that I think using that added layer of treatment and regeneration is just beneficial overall.
So the orthobiologics using the biologic component of our body's response, concentrated, hyper-concentrated, and delivered in a very focused manner, and the shockwave therapy using the body's natural response to trauma. In other words, we're kind of simulating a trauma and then giving you all the types of regenerative substances you need to recover from that trauma. And the initial data that we were presented at this conference looks extremely promising to even raising those outcomes even better to what we're already doing.
Yeah. So hopefully, our patients who are in our clinic, they'll continue to participate in the data biologic data registry. So again, can track these outcomes, whether treating it with just the orthobiologics versus using shockwave and other modalities on top of that, then we'll get a better idea of how really effective it is, not just something that's theoretical that we're thinking. I guess the other question too is, can you use shockwave on its own as its own treatment?
Yeah. So in particular, people involved in their season, whether you're an athlete who's participating in a sport or just right now it's coming up on golf season. I don't want to take any kind of time off to recover from my regenerative procedure. That's why I did mine in the winter. Well, if I have a kind of a nagging injury and I just want to try to get through the season, a lot of times we'll talk to people about cortisone shots. Just to give them time, to give them some pain relief, to get them through the season, so then do their regenerative procedure afterwards. This gives us another alternative to cortisone, where we can get a body's more natural response, and either if we can't exactly heal the tissue, at least hold it at bay and hold the condition at bay until we have time to do the stem cell or the platelet-rich plasma injection later on in the year.
Yeah. So it definitely makes sense to do it that way. It said with the orthobiologics, like Dr. Nabby said, usually we treat it, we put our patients on restrictions for a few weeks afterwards because we want to let the body kind of do the healing part of that. But yeah, with Shockwave on its own, it's effective, and you don't have to have any restrictions whatsoever. And there really is not a lot of contraindications to it either. Everyone can pretty much take advantage of it. The things that we watch out for, like active tumors in the area, fetuses, infections, like a very severe stuff that we won't do any treatments whatsoever anyway, which kind of gives it a broad use. Right?
Yeah. So the other technology that we want to transition in that we'll demo as well is that EMTT technology.
Yeah.
How does that differ from Shockwave?
So EMTT uses magnetic energy to actually make the cells more bioactive. So EMTT is a more newer technology to come after Shockwave, but the idea behind it is that you're using magnetic energy in order to utilize the biologic function of the cell. So the way to think about it from a molecular point of view, magnetic energy actually helps open up the channels in your cell membrane. So by activating these channels, you're allowing the cell to have more efficient and faster metabolism. So with regards to healing, cell function, even production of ATP, which is the energy product of the cell, is also improved by the use of EMTT. So one way to kind of simplify how EMTT works in conjunction with regenerative medicine is it kind of supercharges that orthobiologic or that Shockwave treatment because it makes the cells a lot more conducive to healing and repair.
So in my brain, it's one's working on the release of the growth factors, and the other's working on more of the cellular receptors. So EMTT is really helping the cells be ready to receive that orthobiologic or that Shockwave therapy, and the two work very well together. So we decided, boy, if the combination is better than the single treatment alone, we better get both.
Yep. So I want to say, like here in our office, we usually treat EMTT along with Shockwave together because they do go hand in hand. But there's different cases where we would treat one versus the other, but I would say majority of the cases we would use both. So I think for the next piece here, I don't know if you want to get some questions that we can kind of do a demo.
We see the questions coming in, but we'll do a quick demo, and then maybe that might answer some of the questions, and then we'll take the questions at the end. So I'm going to be the patient, and Dr. Santana here will treat my Achilles tendon calf muscle with the Shockwave therapy treatment, and then we'll demonstrate how the EMTT works as well.
Yeah. Okay. This is our Shockwave device. This is our EMTT device. So with the Shockwave, it comes with a handheld piece, and then we have different applications depending on the depth that we're trying to treat. So for this one, we're trying to hit Dr. Navi's myotendinous junction here in this area where we know he has a little bit of a tightness in there. But depending on the areas that we're treating, whether it's shoulder, hip, knee, ankle, fingers, wrists, something like that, then we would change like the pieces on here that we need to do. We use ultrasound gel right on the site. And as you can see, it's fairly simple. You just need a knowledge of anatomy. And there's different settings that we would do. So there's different, it's counted in millijoules, and depending on the site that we're going to treat, it's going to depend on patient tolerance as well as what we see here. Okay. Is it okay?
No.
So I'm going to move it around. Let me know when you kind of have that area that's kind of the most tender spot.
Okay.
Right there?
Right there.
Okay. More inside, you think?
Mm-hmm.
Right here?
Yep.
More inside?
Nope.
Back here?
Yes.
Okay. So it's a nice way because it finds the most tender area, which is where you have the most pathology. And then from here, we usually try and increase it to the efficacious range. So How's that? Is that okay?
Tolerable.
Okay. That's okay?
Yeah, definitely.
So we're on a good therapeutic range here, which is about 0.2 millijoules. So we're kind of doing about a 1500 pulse for this one. What are you feeling, Dr. Navity?
Yeah, it's just like a thumping, like a snapping, nothing intolerable.
Is it right at the like deep in the structure? Or
Yep.
Okay.
Yeah, deep in the, you can feel it in the tendon.
Okay. And then when you have this pain, is it generally in the same kind of area?
Yeah, it feels like the muscles pulling
Okay.
when it hurts, which is similar to what it feels now. Not intense at all, but.
Yeah, and then the goal that we want is you don't want it to be painful. We just want it to be at the point where you tolerate it, because it can go increase at a certain point. There is a range of healing that we want to shoot for depending on the tissue that we're trying to do. So we know that Shockwave, we can use it to treat peripheral nerve injuries like carpal tunnel, things like that, tarsal tunnel syndrome. So something like that to ligaments and tendons, and then even as far as fractures. So it's been shown to actually treat fractures as well. There's been studies that show that it helps healing with fractures, so which is really nice, because again, it's not invasive. So it has like a stop there. Are we still right on the spot?
Yes.
Okay. So it's really a benign treatment, very well tolerated. So it does make sense to incorporate it with your orthobiologics, since we have the tools to do it.
You've done both PRP and this for me here. This is nothing pain-wise compared to the PRP.
Oh, good. The other thing to consider too is like with the Shockwave, sometimes patients can get bruising right in the area, so nothing to be alarmed with. The other thing too is there is some time delay before you would notice some improvements. Kind of same thing with PRP or any other orthobiologics, that they'll take a few weeks before you would notice some improvements. So it's not an instantaneous type thing, but again, because it's going by the whole premise of healing the tissue. Okay, and then so this is our EMTT, also called the magnetolift. This one, it's really pretty straightforward. So it comes into this device, this handheld piece here. Lock in place. So this is, again, another really straightforward device. It's just a handheld piece that we have on here. And we kind of put it right at the site where you want it to be treated. This one is really nothing much to it. What do you feel there?
Nothing at all.
It's true, like you really don't feel anything. There is some precautions for people who have metal in their system, like implants, pacemakers, defibrillators. As long as the hardware is MRI compatible, usually this device should be compatible with that too. But if not, typically we would kind of start with a low setting, and then we kind of see how you respond to it. Typically, if it's something that reacts to the device, it will start to heat up. So if you notice any heat anywhere, then you know that it's not compatible with that. But this is it. This is the treatment. So we do the treatment with the Shockwave, followed by the magnetolift or the EMTT. And between these two things, we do a protocol and a series of treatments. Again, non-invasive, really easy to do. You can do it while in season. Not much changes you have to do as far as your activity level afterwards. Very well tolerated.
So we can,
Yeah, you want to?
we can take questions now. We don't need to complete the treatment, but
Yeah.
this will be it's a 2,000 pulses. We're almost at 1,000, so the amount of time I've been under the EMTT is almost halfway over. You can see it just doesn't take very long to incorporate this as well.
Okay. Let's see. Do you folks ever here? I'm gonna sit down.
Yeah.
Let's see. A lot of people are professing their love for Dr. Manning.
let me read the questions. All right. All right. Is there a recovery time frame after the treatment? So there is no recovery time frame. You are free to continue with your activities as you tolerate. There is something to be said for allowing your body time to heal. So it depends on where you're starting from. I would say if you're starting from a lower level of activity with a higher level of damage or pain, then I would have you back off in your activity. Allow 3 or 4 treatments so your body can respond to this, regenerate, and heal the tissues such that you can start tolerating activities again.
Yeah, so I usually tell my patients that not to expect much improvements until about maybe 3 weeks after we complete the session, right? Because it still goes by the premise of having your body heal the tissue. So that takes some time to do, looking at how inflammation works and proliferation, and then finally regeneration of the tissue. It kind of still follows that same pattern. But during the treatment, there's no really changes you have to do other than stop taking any anti-inflammatories. So things like Motrin, Aleve, stuff like that, steroids. But other than that, it's very nothing major. Let's see. Do you folks ever treat problems with feet such as bunions, ankle pain, or foot pain issues? Short answer is yes. So what we'll have you do is come in for an evaluation, and then we would give you options of kind of how to treat those areas and kind of what's the best way to do it. Katrina is asking, where is your practice located?
So we're in downtown Rochester, Michigan, right on Main Street. Call the office and we'll be able to give you directions, turn it into the parking lot. But right on Main Street, downtown Rochester.
Okay. Next question is, can either of these treatments help, number 1, recover from a rotator cuff surgery? Yes. Number 2, medial meniscus tears? Yes. Number 3, bursitis in the joints? Yes.
So medial meniscus tears and rotator cuff tears are 2 of the most common things we treat here. So very applicable for these treatments as well as our orthobiologic treatments.
Okay. And the question is the procedure typically covered by insurance? So a lot of these regenerative medicine procedures are not covered by insurance. We do take HSAs and FSAs if that helps, but we try and build the insurance with your office visit, some steroid injections that your insurance plan will cover, but most regenerative medicine treatments are not, and this is one of those treatments.
Unfortunately not. All part of the reason we're using data outcome registry and tracking outcomes, gathering that data, showing the benefit as well as the cost savings. But as of now, it's an out-of-pocket expense that is applicable for HSAs.
Okay. So this is a good question. Is it related to TENS treatment I had in physical therapy?
It's very, very different. TENS uses a electrical stimulation, neurovascularization, and some other like getting blood flow to the area to improve the tissues. But the depth that it penetrates is probably the biggest difference between what these 2 therapies have to offer
and a TENS unit.
Yep. So I guess one way to think about it is like so a TENS unit is mainly for pain management, right? Shockwave and EMTT is for regenerative medicine. So actually, it's healing your tissue. So a little bit different sort of treatments. Both work very well. Again, it follows to the other question: is EMTT similar to PMF? So PMF is a very popular treatment now that's used for healing as well. They're very similar, but also different. They're both using magnetic waves. But if you think about it, the PMF, EMTT uses magnetic energy.
Same as a PEMF device.
Correct.
But at less frequency.
Correct. So one oscillation of PMF, one oscillation of the the EMTT is equivalent to about 40 of the PMF. So it's a lot stronger, higher frequency magnetic energy than PMF.
Very similar technology, very similar mechanism of action. We are actually considering quite a high quality PEMF device, and then EMTT showed us much better science backing as to why it works better than PEMF.
Yep. And then Gary asked, are multiple treatments necessary to see results? Yes.
Most of the time.
Most of the time. So good answer. Because so typically the protocols for Shockwave and EMTT is you do need serial treatments to get improvements, usually around the area of about 3 to 6 of these treatments. But since we're incorporating it with orthobiologics, or if you've had a history of orthobiologics before, so there's a lot of factors that go into it that maybe you only need one treatment to touch up an area that we already treated, and now it's just being irritated for a small reason. So you don't necessarily need the full treatment if it doesn't call for that.
Yep.
So
it just depends on how severe the case is, and if your goal is here and you're starting here, one treatment might get you there. But if your goal is here and you're starting clear down here, you're probably going to need 3 or 4 treatments to get to your goal.
Okay, I think that's most of it here.
Yeah, unfortunately, there's a lot of questions that we couldn't get to. We apologize. Running short on time, but hopefully you all found this interesting, educational, and realize that we're committed to staying cutting edge. We really do want to be leaders in regenerative medicine in Southeast Michigan, and we want to make sure we're incorporating all the new technologies that allow our patients to continue to experience such great outcomes.
Yep. And again, thanks for you guys for tuning in. And I know that you guys are really interested in this, and we're happy that you guys are also interested in what we have to offer you. And then hopefully, if you find this useful, just give us a call, schedule an appointment. Hopefully, we can help you out and make you feel better.
Yep, Michigan Center of Regenerative Medicine, Rochester, Michigan, 248-216-1008. If you think you or someone you know could benefit, give us a call. We'd love to take a look.
All right. Good night.
Thank you.